How do we treat PANS? Well, there's some really good information out there, and there's actually evidence and some research out there that shows we have ways to treat this. So Stanford has amazing resources on their website. There's a neuroimmune institute. There's the physician PANDAS network out there. So lots of good information out there. So we need to treat it in a three-pronged approach. The first thing that we need to treat is the infection. So we look for active infection in children and go after that type of infection. Now, there are a lot of viruses that can cause PANS: COVID, flu, regular, just everyday viruses. So obviously we can't treat those with an antibiotic because antibiotics only work for bacteria, but we do want to go after the infection that the patient's having. The second thing is the psychiatric symptoms. So that's going to be with a lot of support and behavioral modification for the family. So educating the family, giving them support with a therapist who is well versed in PANS and PANDAS and CBT. As well as maybe some school modification. Sometimes we do have to treat with medications for things like ADHD or anxiety to help support the child through this until their PANS can improve, and then they can often come off of those medicines. And the last part is treating that inflammation. So there's lots of ways that we can treat inflammation. One really simple one is NSAIDs. So this is ibuprofen, this is Advil, this is Motrin, this is Aleve. So treating with NSAIDs, sometimes we use oral steroids, sometimes we use IV steroids, sometimes we need to step it up even beyond that. So it's really that three-pronged approach. Talk to your healthcare provider, look at those great resources online, reliable information. Don't get your news and your information from TikTok. Really find something reliable to work off of.